Welcome back to Empower Indie Podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The Empower Indie Podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org. A stroke can happen suddenly, and recognizing the signs quickly can save a life. Today, we're talking about stroke awareness, including what causes a stroke, the warning signs people should never ignore, and what to do if you think someone is having one. Let's get started. So, can you introduce yourself and a little bit about what you do?
Yeah. My name is Kelsie Maher, and I am the trauma and the stroke coordinator for the hospital. So I do a lot of education on strokes with our staff at the hospital, but then I also do reporting to the state about how well or how not well we do with our strokes, and we actually do very well out here.
Okay, awesome. So, to start, can you explain in simple terms what a stroke actually is and what happens in the brain when you're having a stroke?
Yeah. Minutes, a few seconds, it could be a few hours. It kind of just depends, but it's lack of blood flow, either from a bleed or some sort of a clot in the veins.
Okay, so sometimes we hear the term mini stroke. What is a TIA and why should people take it seriously?
Um, well, you should take them very seriously because having a TIA, most people have a full-blown stroke within 3 months of having a TIA. And it's just like a transient ischemic attack. It is a brief decrease in blood flow to the brain, and your symptoms resolve typically within a few minutes. Sometimes it can last up to an hour or so, but they resolve quickly. And so that just is a very good precursor. And actually, half of the people that will have a stroke within the 3 months of having a TIA, it happens within the first week. So
Okay.
very important to seek medical care right away.
And to just watch for the signs and know the
Yeah,
signs
for sure.
and I think sometimes what I've noticed as a provider that sometimes they'll have those and they know what it is and or a family member has had one before and so then they kind of ignore it or family doesn't take it serious and then they don't get the re-education on what to look for the big one.
Yeah, definitely. And we kind of see that too. Or they think that, oh, I've had this before, it's just going to go away, and then it doesn't go away.
Right. And now they've wasted valuable time.
For sure.
Yeah. So there's different types of strokes. Can you just kind of explain them and explain how they differ?
So there's two different kinds. There's ischemic and there's hemorrhagic. The ischemic is like a blood clot in the vessels leading up to your brain, or there's like a bleed. So either way, your brain is not getting the blood and the oxygen that it needs.
So talking about those signs that family members especially can look for, many organizations use the acronym Be Fast now. So can you just kind of explain to us what Be Fast stands for?
Yeah. So B is for balance. So any sudden changes in your balance, feeling off, dizziness, things like that. E is for eyes. If you have sudden changes in your vision, particularly in one eye versus the other. Some people get blurred vision out of one eye. They can't see out of one eye or something just isn't right. And then F is for your face. People notice like a facial droop, one side versus the other. A is arms, so arm weakness and leg weakness. They might not be able to use that arm or leg, or it just seems off to them. S is speech. Some people, their speech isn't right. They don't sound right, slurred speech, garbled speech, or sometimes they might not even be able to talk at all. And then time. Time is very important. It's the last known well time, but also time to get help.
So are there symptoms people sometimes overlook or dismiss that could actually be signs of a stroke?
Yes, headaches, especially for people with migraines. They kind of just think, well, this is normal. I have migraines. Oftentimes, though, their headaches will be a little bit different. They'll be like the worst headache of their life. And then dizziness is a big one too. That people just, I've had vertigo in the past.
Right. Yeah. I actually had a patient that was 40 years old. He had been hunting and he just started to get vertigo. He had never had it before, but he had it for a few days. Went to the chiropractor, a few different times, and then walked into the clinic. And I was actually a new grad at the time, and he's like, "Yeah, I don't know. I've had some vertigo, and I'm just a little dizzy." And the only difference that he had was he would stand and he'd lean to the left, just a little bit off, and he would kind of like he'd be standing and he'd just like tilt a little bit. And it was very, very like very subtle.
Yeah.
And I was a new grad, so I'm like, I know this is probably overkill. I'm really sorry, but I really need you to go to the ER, please.
Yeah.
Will you please just go? Because I really think that maybe you should go. And I thought for sure I was overreacting. And I was like, they're going to laugh at me. Like, it's going to be dumb because he's not going to be having a stroke. And we went down there because I was like, well, it could be in your brainstem. And then he gets down there and he was having a stroke. And I was like, oh, thank goodness.
Yeah.
But it had been days.
Yeah, I would say the dizziness, and like you said, they lean kind of one
Yeah.
way or another, but it's so subtle that like if you don't really,
Right.
if you aren't really watching or have someone that can watch out for you, it oftentimes
And he
goes
drove there,
unnoticed.
came in by himself.
Yeah, it's
like
wild.
And was having a stroke. And then he ended up having, there was actually a cardiac anomaly, and that's why he had thrown the clot, was because he actually had a cardiac anomaly that needed to be fixed.
Yeah.
So, very subtle signs.
Yeah.
But it's really hard to recognize sometimes.
Very much so.
Why is it so important to seek medical care immediately if someone might be having a stroke?
So you, within 24 hours, you're still within treatment guidelines. So treatment guidelines, or if you're within 4 hours, 4.5 hours, you can get a powerful thrombolytic to kind of bust up that clot if it's not a bleed. And then within 24 hours, you can still go to interventional radiology and they can retrieve the clot if like the damage isn't already done. So, but you only have so long. So that's why time is very important.
And if they think they are having a stroke, what should they do?
Seek medical attention right away. Have someone drive you if you can't drive yourself. Call 911, something like that. But just get help. It's not a waste of anyone's time.
Mm-hmm. And then who's most at risk for stroke?
So men have more or are most likely to have a stroke, but women often die from strokes. So there's that fun fact. But also people who smoke, vape, do any drugs, people who are overweight, obese, high blood pressure, diabetes, things like that, they all increase your risk of stroke.
So we sometimes hear that stroke is affecting younger adults more. Are you seeing that?
Yes and no. I think that it's kind of crazy to hear about a young person having a stroke, and so that kind of sticks with you more. But there's a lot more diabetes and blood pressure issues in younger adults too now, as well as young people having strokes, and like you said, cardiac anomalies. They can cause this, and that's kind of how people find out that they have them.
So that leads to the next question is, how important is managing blood pressure, cholesterol, diabetes, and when it comes to preventing stroke?
Very, very important. So like that increased resistance on your vessels, it just weakens them throughout time, and that's usually where you get the bleeds from, is the decrease in or the breakdown of your vasculature. So just taking your medications like you should, exercising, eating healthy, following up with your doctor. It's all very important.
So say someone has a stroke, depending on what the severity of their stroke was, what would recovery look like for them?
Some people have a stroke and they are eligible for the powerful thrombolytic, that blood thinner medication, and they get that and they go home within a few days with leading a normal life. Some people, they get that and they don't recover because the time has been what's done was done.
Mm-hmm.
Other people can do months and months of therapies and not even really get back to their baseline. So it really just depends on how severe the stroke was and kind of their body and their
Right.
health.
And maybe, if they did have a cardiac anomaly and they have to have a surgery, like those things also play a factor in that,
Right.
trying to recover afterwards when maybe they had something else that was actually causing it too.
Yeah.
So, as we close out today's episode, remember that when it comes to stroke, every second matters. Knowing the signs and acting quickly can truly save a life. If you notice sudden numbness, confusion, trouble speaking, vision changes, dizziness, or severe headache, do not wait. Call 911 right away. Quick action can make all the difference in recovery. Thank you for joining us this important conversation about stroke awareness. Until next time, stay informed, stay empowered, and we'll see you on the next Empower Indie podcast.